So I read this survey from the Trevor Project, and really it is just disturbing to see that there are so many LGBTQ young people between the ages of 13 and 24 nationwide who they talked to, 28,000 of them, and released this data today in their annual mental health report. The results show that an accepting environment and access to mental health services can truly be the difference between life and death. And those who I spoke with within the LGBTQ community say the data just doesn't surprise them.
I know so many people who have attempted, who have had suicidal thoughts. I think it's shocking, but I think it's the hard truth that everyone needs to know.
Alex Carroll has no shortage of stories about the mental health struggles within the LGBTQ youth community. 41% seriously thought about attempting suicide in the past year, according to a new study on mental health from the Trevor Project.
I'm in that 41%, and once you're in it, it's honestly really hard to get out of it, even if you have a super great support system.
Middle school was a really rough time. I personally attempted twice, and because I was not able to get the proper help I needed.
Kat Garcia and Quinn Canales are two of Alex's friends. They're all part of the nonprofit NYC Youth for Trans Rights and say that a support system and mental health resources are life-saving.
I have very great counselors at my school, and if I hadn't been feeling like I was able to talk to them, I don't know what I would be doing. I don't know how I would be feeling.
The Trevor Project study shows 81% of all LGBTQ young people wanted mental health care in the past year, but 56% didn't receive any.
There aren't enough services out there. There is not enough cultural sensitivity, cultural competence with the providers who are providing that care.
According to the Trevor Project's research, just a little understanding and a little support can go a long way. LGBTQ young people reported lower rates of attempted suicide if they had access to affirming spaces and gender-neutral school bathrooms and lived with people who respected their pronouns.
Just using a trans child's chosen name and working on that and doing that consistently makes a massive difference.
As little as a name could really help and could really make somebody's day.
Raven Benjamin summed it up like this.
You need to realize we're people too. We're not that different than you. We were just born in the wrong body, and we shouldn't be treated badly for that.
Now, politics also plays a big role in the mental well-being of LGBTQ young people. Nearly 1 in 3 said their mental health was poor most of the time or all of the time because of anti-LGBTQ policies and legislation.